Assalamu alaikum. Good morning. Today we will have another subject in PNS, in Neuroscience 2, regarding enteroviruses. We are going to talk about these important viruses from basic structure, morphology, physical properties. Also, we will deal with epidemiology, pathogenesis, clinical presentation of the diseases in summary, of course, laboratory diagnosis, treatment, and prevention few lines. Starting with the enteroviruses, they belong to family which is called Picornaviridae. Pico, it means very small. RNA, look to the RNA. Pico, very small. RNA, Viridae family. Okay, so these are Picorna viruses. Picorna, it means very small. RNA viruses. So again, small, naked capsule RNA capsid. Naked capsid RNA viruses. It means they have no envelope. Unenveloped, you should keep this point. Naked, يعني عارية, without envelope surrounding the RNA. It is transmitted by fecal oral route. It can infect the intestine. That is the word entero from intestine. Can cause paralytic disease, can cause aseptic meningitis. That is why we are studying enteroviruses with the PNS. They can cause paralytic disease, can cause aseptic meningitis. Aseptic meningitis, we mean by it viral meningitis, as I mentioned before. Can cause cardiac infection, can cause febrile illnesses, fever. These are the diseases that are caused by enteroviruses. Classification of these viruses, we have these genera, okay? Poliomyelitis, which cause poliomyelitis, شلل الأطفال. Coxsackie viruses, we have two groups, A and B, group A and group B. Ecoviruses, parecoviruses, and enterovirus group A and group B. يعني ماخذ اسم الجروب الرئيسي enterovirus. يعني مثل دولة اسم العاصمة شبه اسم الدولة. يعني في هيك دول. ف enteroviruses can be polio, Coxsackie, eco, paraeco, and enterovirus group A and group B. And we will see the details of these viruses in a moment. So human enteroviruses and their serotypes. هذه السيروتايبس فقط للاطلاع للمعرفة العامة. يعني ما راح أسألك كم سيروتايب في الفيروس الفلاني، لا طبعا. As a polioviruses, we have three serotypes. Coxsackie, group A, group B, 23 and 6. It means that we have more group A. يعني هذه المعلومة إذا واحد بس يعرفها. We have more group A than group B regarding Coxsackie virus. Ecovirus, 26, pareco, 8, and enteroviruses, 4. Just a few. Now, morphological and biological features, as I said, they are single-stranded positive sense RNA. Positive sense, it means there is no need to copy it. It can copy itself and go directly. This is the meaning of positive sense. Single-stranded positive sense positive, and they have a small virus encoded protein, which are called VPG, viral protein genome. Okay? These constitute the capsid of the virus, VPG. They have about 60 copies. You know, these small ball-like surrounding the RNA called capsid. And they have four VPG, from 1 to 4. VP 1 to 3, they constitute the shell outside. The VP4, inner surface. Right? So we have 1 to 3, the shell, and VP4, the inner surface. So why I am saying this? Because the antibodies which are going to be formed will be against the external, not the internal. The internal is hidden from the immune system. The virus can enter into the cells that will be infected by a process similar to endocytosis. We call it here viropexis. دخول الفيروس إلى داخل الخلية via receptors. What are these receptors? CD55, ICMI. These are receptors just to catch the virus and phagocytose them, or cytosis, endocytosis of the virus by a process called viropexis. And we will see more details about it. Once the virus enter into the infected cell, they are going to uncoat the RNA. The VPG will be removed, the capsid around the RNA will be removed, and the RNA genome will be released. كأنما واحد دا يشيل الكوت تبع ال RNA اللي هي الكابسيد التي تحتوي على ال VPG. Once the RNA is liberated in the cell, messenger RNA polymerase are formed. Then the cell start to produce new virions assembled and released once the cell is dead. The viruses will be liberated and the process will be repeated. You can see here that the virus comes, this green one, attached to the cell by CD55 and ICMI, and the virus enter inside the cell. This is the capsid, and these are the VPG around the nucleic acid. Then the VPG going to be dissolved or broken, and the RNA will be released. Okay, the RNA, the red ones, will be released and start to form polyproteins, and the RNA polymerase going to form a new VPG and a new nucleic acid, which will be surrounded again in complete virions and will be released to outside the cells once the cell is dead. This is the process, very logical. يدخل الفيروس, remove the capsid, RNA يتحرر ويبدأ عملية البروسيس مرة ثانية, messenger RNA polymerase, تكوين النيوكليك acid مرة ثانية, and a new capsid, and then the virus will be released to the outside. Resistance and susceptibility. This virus has very important characteristics regarding resistance and sensitivity. They are resistant to acidic pH, about a 3 pH. That is to say, they are resistant to stomach acidity. They cannot be destroyed by the stomach acidity. That is why it can pass the stomach and go to the intestine and cause infection in the intestine. Also resistant to 70% alcohol. Nowadays, 70% alcohol is available everywhere because of the corona. Some people think if they are going to spray on their hands or their table 70% alcohol, everything will be killed. No, this virus is resistant to 70% alcohol. Also resistant to phenolics, resistant to ether, detergent. Very important. These are substances that we are using them on daily basis. Our viruses today are resistant to all of these. However, they are sensitive to 0.3% formaldehyde. Good news. Also resistant to chlorine, to chlor and hypochlorite. Also, this is good point. And this virus has characteristic of mutations, antigenic mutation. طبعا خاصية الفيروسز بشكل عام، يعني اليوم احنا نسمع على الكورونا أيضا mutations. الفيروسز بشكل عام بها mutations. Antigenic mutation and the drift which occur changing the antigen is called the drift. Okay, so the antibodies will be formed against VP1 to 3, as I said, which can neutralize the infectivity. يعني الانتيبوديز تتكون against the external proteins, not the internal one, اللي هو VP4. growth in laboratory. طبعا خواص الفيروسز بشكل عام تنمو بشيء اسمه tissue culture or cell culture، يعني مو culture تبع البكتيريا على ايجار اللي تعرفوه. هون تنمى الفيروسز على بليتات وتوضع بالحاضنة اللي بيها مواد غذائية وخلايا. So a primate cell culture, human cells or simian. simian معناتها قرود، خلايا من القرود، تباع طبعا بالمختبرات. Now these viruses can grow on these cells. يعني الفيروس تعرفون لازم يحتاج خلية ينمو عليها. So either human cells or simian cells and cause effect on these cells, which is called cytopathic effect. يعني نعرف هذا الفيروس من خلال نوع السيتوباثيك effect على هاي الخلايا. يعني شغلتين، نوع الخلية human or simian، والنقطة الثانية شو الإفكت اللي يعمله الفيروس على هذه الأنواع من الخلايا، which is called cytopathic effect. Most enteroviruses اللي شفتوا عدد السيروتايبس عدد كبير can be grown in this way. Also, there is another way. You can inoculate newborn mice. You can inoculate it, for example, with Coxsackie virus, a group A or group B. A group A Coxsackie virus can cause a flaccid paralysis and death, while a group B can cause encephalitis in this newborn mice and spasticity. شو flaccid paralysis؟ يعني تصبح العضلات راخية لينة. It's called the flaccid paralysis, and then the mice will die. While group B can cause encephalitis and spasticity. العضلات تصير متشنجة متصلبة spastic. فإذا لازم نعرف أنه جروب A يعمل إيش؟ flaccid paralysis. جروب B يعمل إيش؟ spastic paralysis and encephalitis. This point should be clear to you. Epidemiology, a human is the major host for enteroviruses. The major host. I am not saying the only host. I am saying is the major natural host. It's spread worldwide. Asymptomatic infection is common. يعني كثير من الناس يصابون بالانتيروفيروسز وهم مش عارفين. Symptomatic, it could be 2% of the cases, but in some situation, it could be up to 100%, depending on the strain and the age of the patient. So the symptomatic variable. It has seasonal predilection, a greater prevalence during summer, and fall in temperate climate بالمعتدلة يعني. So more in summer we will get enteroviruses. That is why many people get diarrhea of viral origin in summer. Transmission direct or indirect fecal oral route. And we mentioned that picornaviruses have this characteristic. Common in children under 9 years. So this is a childhood infection. An incubation period variable between 2 and 10 days. Remember this figure. I am going to use it in a moment. 2 to 10 days, the incubation period. Remember, 2 to 10 days. Pathogenesis, initial attachment, binds viral surface protein to the surface receptor that I have mentioned, CD55 and ICMI. Host receptor may be related to the immunoglobulin integrin families. الريسبتورز اللي موجودة اللي حكيتها هذه ال CD55 و ICMI related to the immunoglobulin and integrin families receptors. These are big families. You can read about them. These are the receptors which catch the enteroviruses. Initial replication in the epithelial cells and lymphoid cells, followed by viremic spread. First of all, they infect the, for example, intestinal epithelium or lymphoid cells associated with the intestine, and then from there they can spread to the blood, and this is called viremic spread. So epithelial cells and lymphoid cells are mainly infected. After they spread, they go to the body inside via blood. They have a tropism. These viruses, tropism, they may go to the CNS and other tissues. That is why it can cause infection of the nervous system. In the CNS, there will be perivascular inflammatory cells, lytic cycle of the virus in tissues. We said once the virus is inside the cells, the cell will be lysed, will be dead after the viruses multiplicate inside the cell. And secondary sequelae, there will be immunological secondary sequelae, and which may result in autoimmune diseases. This is due to molecular mimicry. شو معنات molecular mimicry؟ يعني الفيروس has antigens شبيهة بالانتيجينز لبعض أنسجة الجسم. Once antibodies are formed against the antigens of the virus, these antibodies cross-react with body tissues and cause autoimmune diseases. And there are many examples for this. Antibodies form against a microbe, and then these antibodies can cross-react with other tissues. Example, in bacteriology, for example, antibodies formed against Streptococcus pyogenes. The same antibodies can cross-react with the heart and cause rheumatic fever, and so on for the viruses. A virus, antibodies formed against it, and then the same antibodies cross react with the nervous tissue and may result in Guillain-Barré syndrome, for example, which is a demyelinating disease. In early stages, as others, IgM will be formed, which stays up to 3 months, between 6 and 12 weeks, and then this IgM will be replaced by specific IgG. يعني أنت إذا تريد تعرف عند إصابة سابقة شو تدور على IgM لو IgG أدور على IgG against the virus. If it is IgM, it is an acute recent infection. Immunity. This is the very important. That is why I've told you you have to remember the incubation period between 2 and 10 days. In neutralization methods for many years later on, it means the neutralizing antibodies are formed against the viruses. If it is of IgG, it will stay for a long time. The immunity is achieved to the same serotype, which is a specific immunity. يعني مو مثلا عندك serotype X هذه الانتيبوديز تحميك against Y. لا. الانتيبوديز against X تحمي against X, and so forth. So you can see now, if the person is infected here, in incubation period 2 to 10 days, this is very important figure, please. You have to pay a lot of attention to this figure. Antibody response here and viral isolation from various sites. What are the various sites? From the blood, from the stool, throat, and CSF. We said it goes to the blood, it goes to the intestine, the throat, and CSF, reach to the nervous system. So during the incubation period, which is between 2 to 10 days, we don't have anything here. Everything is negative. At the end of the incubation period, on the 10th day or 9th day, blood start to become positive for the virus. Very transient. For 1 day only, and then it will disappear. Look, negative. Up to 24 days, it will be negative. In the stool, the virus start to be positive on the 10th day and stay positive up to 28 days, and then may continue up to 2 months. These are in months, this is years. Okay, up to 2 months may continue to be shed through the stool. From the throat, again, it starts about 10 days and goes up to 22 days. In the CSF, from 14 up to 18 days. Short period in the CSF. And this picture, these infections in these areas, coincides with the antibody production and the clinical picture. Illness is biphasic, يعني be 2 peaks. The first peak, which is this one, and the second peak is this one. The first peak coincides with malaise, fever, sore throat, okay? So you can compare it with the results here. And the second peak Remember, these symptoms start after the incubation period, from 10th day on, up to 24 days. The second peak, which start about 14 days, it is represented with headache and stiff neck. Stiff neck due to meningitis, aseptic meningitis. So headache and stiff neck. So the clinical picture of this illness is biphasic. In neutralizing antibodies, the green line here, it starts from about 2 weeks, 16 days, and will go up. And if it is of IgG, it will stay for years, while IgM, it will disappear within 3 months, 12 weeks. I hope this figure is clear to you. Pay attention to it. Diagnosis. We mentioned different types of diagnosis, but nowadays, PCR, real-time PCR for tissues and body fluid, viral isolation by routine technique by cell culture or tissue culture, it takes about 3 to 10 days, quite long. While real-time PCR, it takes only several hours. فواحد يروح يسوي tissue culture ويطول له 10 أيام، يكون المريض كان كمل وتعالج والله أعلم النتيجة. بينما ال PCR, it takes only several hours. CNS involvement, we said it may involve the central nervous system. It may be, CSF may be positive between 10% to 85%. It depends on the picture. If it is going to spread to the nervous system or not. Not every infection will go to the central nervous system and will be obvious. The majority of the cases are symptomless, asymptomatic. The result of the infection that we can detect will be neutralizing antibodies. Neutralizing antibodies. So if you would like to know whether the patient is infected or not, whether it is recent or old, you detect neutralizing antibodies of IgM class or IgG class. Treatment and the prevention, of course, there is no specific treatment for viral infections. So symptomatic and supportive treatment we give to the patient. Vaccine is available against some viruses, not all of them. Some viruses, vaccine is available. Let us go through, this is general introduction to the enteroviruses in general. Now we are going to speak specific things about the different genera. Coxsackie viruses can cause different conditions or illnesses. It is related to the serotype of the virus, and we will see the serotypes in a moment. Group A, as I said, can cause a flaccid paralysis, which is due to generalized myositis. Myositis التهاب العضلات. Group B, spastic paralysis. حكينا العضلات تصير صلبة. And this is due to muscle injury and neural degeneration. These are the serotypes of the different viruses and related symptoms due to these serotypes. The syndromes that can arise from enteroviruses in general are 3 categories: aseptic meningitis, encephalitis, muscle weakness and paralysis, including poliomyelitis-like disease. And number 3, cerebellar ataxia. It can infect the cerebellum. Coxsackie viruses, group A, group B. These are the serotypes. دكتور مطلوبة من عندنا هذه السيروتايب؟ طبعا لا. Just information. Just remember that there are certain serotypes can cause these three categories. Some of them can cause more than one type. For example, 9 can cause these, all of them. Okay, 3 can cause these, all of them. Anyhow, 3 categories of syndromes. For ecovirus, paraeco, and enteroviruses, these are the serotypes that are related to these categories of diseases. Remember here, هاي الوحيدة اللي أطلبها منكم E71. E71 can cause muscle weakness and paralysis, right? This is very important to be remembered. E70 also, E70 here is important in aseptic meningitis and encephalitis. And also E71. E70 and E71, aseptic meningitis, encephalitis. E71 related to muscle weakness and paralysis. The others just for information. And you have to remember 3 categories of conditions. Ecoviruses, important cause of aseptic meningitis and encephalitis. وشفناها بالجدول قبل شوي. Other diseases of nervous system, including muscle weakness, paralysis, also we mentioned. Cerebellar ataxia, also mentioned in the table. A treatment supportive. There is a drug which is called pleconaril, which is oral or intranasal spray, يعني في الأنف, may be helpful. Pleconaril is called. Parecoviruses. Group A associated with myocarditis and encephalitis. Group B associated with diabetes. This is new information linking group B parecoviruses with diabetes and intrauterine death. Remember these specific things. We have spoken in general about enteroviruses, but regarding parecoviruses, group A associated with myocarditis and encephalitis, group B with diabetes and intrauterine death. 15 genotypes are identified for this virus. Common infection between the age of 3 and 5 years. Paralytic infection, enterovirus, remember, paralytic infection with E71, which I have mentioned it. And E71 and E70, important in aseptic meningitis and encephalitis. Remember it. This is very important point. Polioviruses. Polioviruses are enteroviruses. Picornavirus. There are 3 serotypes, 1, 2, 3. يعمل شلل الأطفال. لا تنسوا حكينا بالمحاضرة السابقة على another virus which can cause poliomyelitis-like illness. مين يتذكرها؟ Western Nile virus. Okay, remember it. Now we are going to talk about the virus, which is important cause, which is the main cause of poliomyelitis. Spread fecal oral route, multiply in the oropharynx and then intestine, enter cells by poliovirus receptor, PVR. This virus has tropism to the CNS via crossing the blood-brain barrier or via along the axons of nerves or perineural sheath، إما عن طريق البلد أو عن طريق النيرفز، عن طريق الأكسن أو البرينيورال sheath. It goes to the CNS and motor neurons. Look here, motor neurons are infected and damaged. That is why there will be what? Paralysis. A clinical manifestation, 90% of the infections with polioviruses, subclinical and mild. An incubation period variable between 4 days up to 35 days, average 1 to 2 weeks, 7 to 14 days. We have 3 types of infections. This is also important. Abortive poliomyelitis يعني الذي يجهض. Febrile illness with fever 2 to 3 days. There will be no CNS localization. لا يحصل فد إشي بالCNS. This is called abortive poliomyelitis. Only fever 2 to 3 days. Or aseptic meningitis, which is non-paralytic polio. ما حصل هون paralysis. Only meningitis. Meningeal irritation manifested as neck stiffness, back stiffness, pain. These are the manifestation of meningeal irritation. Recovery is rapid within a few days only. Aseptic meningitis, as if it is viral meningitis, usually meningeal irritation, stiffness of the neck and the back, pain, maybe mild fever. Recovery is very rapid. In less than 2% of the cases, paralytic poliomyelitis. There will be period of mild illness and then asymmetrical flaccid paralysis، يعني غير متشابه في جهة واحدة من الجسم. asymmetrical. الباراليسيس in general من نحكي بالميديسين إما يكون symmetrical أو asymmetrical، متماثل. symmetrical يعني بجهة اليمين يشبه جهة اليسار. أما هون you will get paralysis, flaccid paralysis, which is asymmetrical. مثلا رجل اليمين وليس اليسار. انتوا تشوفون مرات بعض الاشخاص شلل الاطفال عنده ولو هسه نادره، بس لا زال بعض الناس اللي اصيبت من قديم عنده شلل مثلا في الرجل اليسرى. Prevention, there are 2 types of vaccines against poliomyelitis. Inactivated or killed polio vaccine, IPV, which was prepared and developed in 1955 1955 by SUC اسم العالم. That is why it is called SUC vaccine. بعض الناس تلفظها SULC. It is not pronounced SULC. SUC vaccine. Subcutaneous injection of 2 doses, 6 to 8 weeks apart، يعني شهر ونص إلى شهرين ياخذ جرعة، starting at 2 months. يعني ياخذ جرعتين، جرعة بالشهر الثاني وجرعة بشهر الرابع. Then third dose within 1 year, 8 to 12 months. Antibodies will be produced, which will be protective in 98% of the cases. It can stimulate serum IgG because multiple doses, it will create secondary immune response serum IgG that can eliminate viremia if it occurs. الجملة الأخيرة راح أحكي لكم إياها لاحقا بعد ما أكمل النوع الثاني. The other one is oral polio vaccine, OPV, live attenuated. هذا حي. الأول كان inactivated killed, مقتول الفيروس. الآن live attenuated, فقط it has been weakened to become apathogenic. It has been prepared almost 10 years after, in 1963, by Sabin. Scientists called Sabin. That is why it is called Sabin vaccine. So remember, against polio, we have Salk vaccine and Sabin vaccine. It's oral vaccine. ويمكن شايفيه هذا اللي يعطوه على شكل قطرات بفم الطفل، هيك قطرات وردية اللون، 3 قطرات في الفم توضع. It is given 3 doses as Salk vaccine. It can stimulate mucosal IgA, that is to say in the intestine. لأنه it is given orally, so it can stimulate mucosal IgA. Once you have got IgA in the mucosa of the intestine, it can prevent the entrance of the virus via the intestine. This virus, because it is live attenuated, it can multiply locally, local multiplication. However, it has advantage to use lower doses than Salk vaccine. But the risk, because it is live attenuated and is going to multiply locally, it will be shed by the stool, via the stool. يعني هذا الفيروس يتكاثر في الانتستين, and some of it will be shed with the stool. Once the child shed, the vaccinated child shed the virus with the stool, it will be spread. So immunocompromised individuals may be infected. الأطفال اللي مناعتهم قليلة, immunocompromised, may be infected. And this represents risk if these children are not vaccinated. For this reason, just a few years ago, Sabin vaccine has been stopped in USA and some other countries. They are using the killed vaccine, which has no such a problem, which is stool shedding and spreading to immunocompromised. So nowadays in USA, they are using the killed vaccine. Other countries, most of the Middle East countries, are using the Sabin vaccine. This infant has been infected with parecovirus. Any question? Any question? Please do ask.
دكتور شو الفرق بين الكاسبيد والكبسول؟
الكبسول لغة بالبكتيريولوجي، يعني الكبسول اللي تحيط البكتيريا. الكابسيد هي multiple proteins surrounding the nucleic acid. If you go to a structure of a virus, you can notice that. وعرضت لكم viruses, different viruses, and the nucleic acid is surrounded by capsid. والcombination ما بين النيوكليك acid والكابسيد, it is called nucleocapsid. واضح؟ وطبعا داير مداير around the capsid, some of the viruses have envelope. So the viruses can be classified into enveloped viruses and unenveloped viruses. Today مثلا الانتيروفيروسز are unenveloped. Clear؟ واضح؟
حكينا ان انفلوب، بس حكينا بعديها انه في عليه كابسد اظن.
الكابسد جوانية تصير. يعني أنا لو خليني أوضح لك، يعني لو فرضنا هذا الRNA، تمام؟ والكابسد هذه هذه اللي تحيط الفيروس على شكل دوائر. أوكي، بهالشكل هذا. تكمل هاي الدائرة، هاي هي الكابسد. أوكي،
تمام.
الفيروسز اللي بيها انفلوب، الانفلوب راح يكون خارج هاي المكان. لو ترجع إلى أي فيروس ستراكشر راح تشوف فيها هذه. إذا ما واضحة أشوفك صورة لها، بس أعتقد يعني هذا basic general microbiology. You can read about it. النيوكليك acid surrounded by capsid. الكابسيد ترجع surrounded by envelope. واضح؟
واضح دكتور.
تمام. Another question? Other question? Please do ask, even if it is just basic thing. Okay. If not, if there are no questions, I hope I will see you next time, inshallah. Next lecture. Have a nice day. Assalamu alaikum.
وعليكم السلام.